At this point, I will ask Professor Anne St. John to just share a little. As you know, Professor Anne St. John has been very involved in the fight against childhood obesity prevention and has been very focused on the work that we have been doing in the schools, and we'll now ask her to give her status report from her and the coalition's perspective.
Thank you, Francine. Good morning to everyone. Happy to see you here. I will give a little bit of information about the work of the Barbados Childhood Obesity Coalition. We're encouraged by the uptake of the school nutrition policy and other initiatives, but hoping for further strengthening of childhood obesity policies due to concern about the impact of non-communicable diseases. Some insight into the school nutrition policy. We have school nutrition tours. We've identified 68 primary schools and 21 public secondary schools, and so far since the beginning of year we have managed to tour 40 schools last term, 30, and 10 this term so far. A critical part of civil society support for the school nutrition policy is the ongoing education and outreach of key stakeholders. From the start of 2024, the Coalition Youth Advocates have played a vital role, going along with students of the University of the West Indies, Medical Students Association. We have also had some assistance from the students of the Ross University, visiting schools twice a week, spending about an hour, and we do an active education process, looking at the importance of healthy diets and exercise, encouraging students to support the policy. The tours use interactive presentations and games to bring the messages alive, and response from the children has been very encouraging. The Heart&Stroke Foundation engagement with government has included the Ministry of Youth, and we had a meeting as recently as October, looking at key messages with the Minister of Sports, Youth and Community Empowerment. Members of his team, including representatives of the National Sports Council, had discussed with us. We're trying to advocate for extending the SNP to cover summer camps, looking at collaboration for educating young people about healthy lifestyles and to register concerns about the sponsorship of the national sports by unhealthy food companies. This is very, very dear to our concern. Fruitful meetings were held, and it was agreed some immediate actions will be taken, as well as follow up on the issues around school sports sponsorship in particular. We believe this fight against childhood obesity is a multi-pronged, multi-sectoral, and does not lie solely with the Ministry of Education and the Ministry of Health. Looking at a medical perspective on the policies and health for our children, a key message as a pediatrician for many years and director of the youth gym at the Heart&Stroke Foundation, I've seen firsthand the challenges of obesity in children, the significant and destructive impact of the NCDs as the children get older and become adults. On the International Diabetes Day last week, the government indicated that 3% of the GDP goes towards treating NCDs. We know that 375 million Barbados is lost directly and indirectly to NCDs in Barbados. The cost of the national purse is more significantly to people's quality of life, and it must not be understated. Lives are being lost or negatively impacted every day by the challenge that can be regulated and better managed by policies that make healthier lifestyles more affordable and accessible. We have a significant ask and have been inquiring about the vending bill. It states vendors must be registered and compliant with the Ministry of Health. It has not yet been proclaimed, and this is causing quite a bit of concern in circles, as it's vital. A major challenge to the success of the school nutrition policy is the vending right outside of our schools. Our hope is that the vending bill that was passed in 2021 would be able to help with regulating the vendors and ensuring compliance with the policy. However, the bill is yet to be proclaimed. Government says there are some final arrangements being put in place. We're calling for government to make this bill a priority, especially as it relates to protecting the school environment. The current status is very unfair to the canteen concessionaires who are trying to comply with the policy within the school's premises, and yet we have the competition unfair outside. We have had some research done in addition to what Ms. Crystal just presented, and local research evaluating the school's nutrition policy implementation done by Shamika Thornhill. And a message came through that we have it's a bit early to evaluate the success to the at least compliance to the school nutrition policy. We do have access to preliminary data from this researcher, and it is encouraging, showing that there is support for the policy by staff and parents. The stakeholders describe the policy as desirable and feasible, admitting that the implementation is not easy. Nothing is easy, and this has been a very difficult and challenging road, but we're making progress. Change never is, but we are seeing a growing understanding of why the policy is important to the future of our children. The data points to good compliance by the canteens, as a majority no longer sell sugar-sweetened beverages, and they sell mainly snacks that are on the Ministry of Education's compliant list, and these things are available. So I would like to close in saying that, again, the Barbados Childhood Obesity Coalition is encouraged by the uptake of the school nutrition policy. We have a good way to go, but we are making progress and are encouraged on other initiatives, but hoping for the further strengthening of childhood obesity policies due to concern about the impact of NCDs and its effect on the national budget and the health of the citizens of the future. Thank you.
Thank you very much.